Hello, my name is Devon Avant, and this is my video presentation for the Applied Concepts course for Dr. Tom Alexander. Today, I'm excited to share just some of my thoughts on some of the topics that we covered throughout this program and throughout the course, and I'm excited to see what's next after this one. I know we were instructed to talk about maybe one or maybe a few of the topics, but I kind of wanted to briefly go over all of them because I thought they all played a positive impact on me. And I've also seen a lot of the things that we talked about in the course at my job as a rec therapist, and also what I plan to do as a psychologist as well. So I'll be briefly talking about the social issues that impact behavior, the laws and ethics that govern psychologists and counselors, having compassion for abnormal behaviors, people with abnormal behaviors, culture and diversity, and the interpersonal styles or the effective communication styles that we see out of a lot of clients. Um, so I'll start with a quote here. This comes out of a research paper called "The Social Determinants of Mental Health and Disorder," and in that paper, uh, they say that there is now compelling evidence that the risk of developing any mental health condition is inextricably linked to our life circumstances, meaning that there is a higher burden of population level psychiatric morbidity and is disproportionately experienced by those closer to the margins of our societies. Just thinking about the things that plague people in our society today, like poverty, like homelessness, like being a minority. Poverty, for example, there's 35 million Americans, or close to 10% of Americans, living under the poverty line today. So thinking about the types of impacts that has on a person's mental health, this is where we are as a country, and this is where we are as clinicians, as psychologists, and wanting to help consider those things in treating and also diagnosing. For me, working in the prison, I see how people's social circumstances impact their behavior every single day. So we have a lot of people who are gang affiliated. We have a lot of people who were neglected at an early age. A lot of people in prison and society in general, but just from my experience, they've been introduced to alcohol, drugs at an early age, and it has greatly impacted their behavior. And these are some of the things that we try to work with them through, kind of normalize them into what normal behavior should look like in terms of socializing, in terms of being able to have take care of yourself, your ADLs, hygiene appropriately, and just getting people back on track. But just seeing it up close, you know, the things around us that are supposed to be, you know, at peace. Oftentimes, it impacts how people think and how people behave. So, let's talk about laws and ethics. This was something I didn't think I would have a lot to say or talk about, but this is a very important conversation, a very important topic I found in this program. So, some of the things that I learned in this program: informed consent, confidentiality, negligence, and also the group legal considerations. I run a lot of groups in prison. I have all different types of ages, backgrounds, and we share information with each other, and they share information with each other in context to the mental health group. So there's a lot of confidentiality issues that come into play, making sure that people who aren't a part of the group aren't in the room. Maybe even certain staff members who aren't a part of their mental health team aren't in the room before we disclose. A couple times we've had to stop talking so the wrong people can leave before we resume again. The one topic of laws and ethics that really struck me was the conversation around dual relationships. And understanding human behavior, people tend to get close to people who govern them in a sense. So we get close to our coaches, we get close to our band instructors, we get close to our dance instructors, and it's the same thing in mental health. Counselors get close to their clients, clients get close to their counselors. And where do you draw that line? Is there a line to be drawn? There absolutely is. But how do you communicate that? How do both parties know what's too much? As a therapist, can I go to my client's son's football game? Can they come to my kids' games? Can we be in business together? It really is all dependent on that informed consent and how much you choose to disclose. So both parties have to come to an agreement, especially facilitated by the therapist. So I thought that was very important to understand in this program. Um, Having compassion for people with abnormal behaviors. So this is what I liked about the vignette assignments. Um, we got a chance to see the different case factors that led to a person's mental disorder, right? We would see the age, and then it would start out, talking about, their background, but then you start to see that this person who has depression and anxiety, PTSD, they experience alcoholism at an early age. They experience gang violence at an early age, and you see that people are not their story. They just had something happen to them, which led to where they are now. And again, where I work, I've talked to many of my patients who came from, you know, gang affiliated areas in Inglewood, Compton, places like that, and you can see like no wonder why they, don't trust a lot of people, right? One of the criteria for PTSD is you experience a traumatic event like death or bodily injury, or somebody who's experienced those things, and now you don't trust anybody, you don't trust anything, and now you're hyper vigilant. Now your heart's always pumping, you're always under chronic stress. So we do see how people's stories impact where they are now, and having that compassion. Honestly, this is why I'm in this business, in this field, is because there are people who have a story, but we don't put into context that story, how that led to that disorder and that conditioning. So this is part of the reason why I love this field and why I love working with people, is to understand who they are and how they got to where they're at. So culture and diversity. So we learned a lot about cultural competence in this program. We learned about a lot about cultural adaptive psychotherapy, CBT, DBT, mindfulness. And one of the things that stood out to me in this program, in the abnormal side of things, was the multi-path model. Now that relates to diversity and culture, because what I've seen is that this field, mental health field, is so broad. Oh, drop my pen. The mental health field is so broad that you have to narrow it down to a set of eyes or something to kind of understand that patient a little bit more off of. And the sociocultural model, the biosocial model, the psychological model, they all kind of interplay and go with each other. Um, One of the things that I liked about the last assignment we just did, we were talking about Sarah and Edward. I'm just using them as an example. Sarah in the writing assignment, she was distraught that she couldn't have children anymore. And when you look at her cultural background as a Taiwanese American or Chinese American, um, family values and prolonging family generations is very important in many Asian cultures. And the fact that she couldn't have children with her husband, it disrupted that family legacy to bear children so that the children can now take care of the parents. And you can see why she had so many issues and was leading down the path of depressive symptoms and also fertility stress, was because she wasn't able to fulfill that cultural value. But I say that to say, anytime we're dealing with patients, to understand their background, where they come from, because that can impact diagnosis and it can also impact treatment. And the last thing I wanted to discuss, the interpersonal styles, or what we call the effective communication styles. So some of the ones that I came across in this program. So you have avoidant, which means when a person steers away from conflict, maybe steers away from unresolved tension. You have bossing, someone who's controlling, dominating, can often create distrust with others. You have supportive, which is where we all kind of want to be at. Empathetic, someone who's attentive, who listens, someone who builds trust in long lasting relationships. And then the last one, defiant. So someone who's agreeable, who avoids conflict and often fears rejection. Um, this is kind of what I feel is the root of a lot of conflict and how we can resolve it is when we understand how to communicate with each other. And one of the things I take from this program and also working with people is you have to adapt to people's communication styles. And also, too, as a therapist, be able to teach people about how to communicate with different people's communication styles. A lot of times we project, if we're more listening and able to listen, that person may not be. They might be more avoidant. They might be more of a bossing style, interpersonal style. So how do you navigate around that? For me, um, being open to communicating with anybody of this spectrum is the heart of alleviating stress and also resolving conflict. And that's one of the things I take away from this program too. Um, that's it. That's my presentation. Thank you for listening, and I'll see you down the road. Bye bye.